The knee joint is the biggest and most complicated joint of the human body that can be loaded with sevenfold body weight during walking and jumping. The joint cartilage is the most important structure of the knee joint. Damage to the joint cartilage due to trauma, overload, genetic disorder can lead to pain, inflammation with limited range of motion, causing bad gait pattern. In total knee replacement, only damaged cartilage surfaces are replaced by an implant that allow patient to do not only normal activity but also sport related activities after surgery. Total knee replacement surgery is considered one of the most successful and life-changing surgeries where rapid recovery is possible due to improved analgesia option apart from various surgical modifications. So why it is called as life-changing surgery? This is our patient who was so much in distress, disabled and dependent on others for daily activities. After surgery, his life completely changed once the deformity got corrected. Similarly, another lady patient with severe rheumatoid arthritis affecting all joints causing deformity and restricted mobility. So one more example of life-changing surgery. So being an anesthesiologist, we should assist them in this transition process by making their journey pain-free. For that, we need to understand the basic steps of this life-changing surgery. Surgery is nothing but the correction of existing pathology and creation of a new iatrogenic pathology, which is the surgical dissection. The knee joint is approached by various incisions, knowledge of which is very important for determining analgesia options. Incision is the first iatrogenic damage where tissue insults begin. Among various approaches, medial parapatellar approach is most common. It is also called as workhorse of the varus knee. The midline approaches are usually used for revision surgeries. Lateral approaches are sometimes needed to correct the severe valgus deformity. In severe valgus deformity, chances of injury to the common peroneal nerve are most common during surgery. That can lead to foot drop postoperatively. So blocks involving sciatic nerve component should be avoided. So it's always better to look for x-rays to confirm whether you are dealing with varus knee or valgus knee, to know whether your surgeon will take medial or lateral approach, as most of the blocks described for knee analgesia may not work for other approaches. Total knee replacement surgery involves various steps starting with incision, extraarticular dissection and intraarticular resection, and fitting of metal prosthesis replacing the articular surfaces of femur, tibia and patella. It is important to note which pain generating structures are removed and retained to plan procedure specific analgesic strategies. The total duration of the operation is around 1 to 2 hours, and majority of the patient begin physical therapy within 24 hours of the surgery. So surgical issues include extensive dissection mainly in the extra-articular region with resection of all intra-articular pain generators, potentially painful surgery due to limited soft tissue around the joint, post-surgical inflammation, healing complication and mobility challenges.